words, and it is really an honor and pleasure to be speaking to all of you this evening. We are going to try to focus a lot about the use of liposuction, which is such a common procedure, and how EMSCULP really fits in and really completes the, quote, body contouring process. And I've been involved with the company since its inception and was very fortunate to do a nice amount of their trials with them. So I got to see it firsthand on how it really worked and help them work out some of their protocols. And I'm really excited to be able to explain a few things to you, and hopefully everybody will get something out of this. And also wanted to say, and I'll say it again at the end, anybody that has additional questions we don't get to, please contact me at my office, and I will make sure that John can furnish that number to you. I can give it to you now at 215-702-1200. My email at richardgoldfarbmd@gmail.com. And again, I'll be glad to answer any additional questions you may have. So I think we're going to start, and hopefully it's really going to be meaningful for everyone. So again, it's post-liposuction use of EMSCULP. So really, we start out about talking about liposuction. Who really is a candidate for laser liposuction? You know, a typical patient will walk into our office and, you know, they'll have a large abdominal cavity and some other abnormalities, and they're just very unhappy with things. And the first thing we have to do is we have to really see if we can help them or not. So did you know there really are two kinds of fats? There is visceral fat, which really is the fat that's on the inside below the abdominal muscle, and that covers your organs. Its primary function is organ protection, as stated on the slide. And then we talk about subcutaneous fat. That's the pinchable fat and the fat that covers your muscles. And this excess subcutaneous fat that makes you look, quote, unhealthy with that kind of gut hanging over, and in other areas such as saddlebags and even in the outer thighs and inner thighs, that excess fatty tissue. And that is very well addressed with what we call liposuction. And we feel that that actually has been tremendous in the way we treat this. We do this in the office today. Years ago, when I first started, we had to do it in the hospital, and actually had to have patients donate 2 units of blood prior to the procedure. It was so bloody. Now it's done as an outpatient in a few hours, and they're out the door, and those complications are taken away. And we want to thank Dr. Klein for his input in helping us do this in the office setting. So having said that, we really do have to distinguish between the visceral fat and the subcutaneous fat. So the initial device that got FDA approved back in November of 2007, and I was involved in their initiation as well, was Smart Lipo, and I still think it's probably one of the best devices out there. Again, any of the laser lipolysis devices are certainly adequate and do a great job. I'm just particularly focusing on one because I use it a lot. So what is it really for? It's ideal for disrupting unwanted fat, and again, treating any fat irregularities, treats many areas. The key is that it does promote the tissue coagulation, and most important, which we'll talk about as far as what EMSCULP impacts, is resulting in tissue tightening. Minimally invasive, minimal at all to no bleeding, faster healing, and less trauma. And if you see on the slide, you'll see the little red dot there. That's called the Haney beam, and that's a reflection of where the laser is reflecting through the dermis and epidermis. So the placement of that Haney beam and the laser goes right at the dermal subcutaneous junction. And again, we're going along in what we call linear tracks in order to melt the fat, as well as the energy is rising to the bottom of the dermis where the papillary and reticular dermis is. And that causes that nice contraction of the skin. And that gives you that nice smooth appearance. So again, this is really one of the mainstays of what I personally still do, and I think it works exceptionally well. So what does it really do? You can see on this particular slide, it produces these tracks in liberating an oily substance from the adipocytes, causing a disruption of the fat cells, and then we remove the majority of them, and the remaining cells are then brought through the lymphatics and eliminated. So again, this just shows what it can do to a blood vessel. Again, as I said earlier, it used to be a very bloody procedure when we first started in the hospital setting, and now it's not, and we think it's really a great procedure. And then we collect the fat in a container like that, as shown. So effects on the adipocytes, again, the laser itself will break the membrane, the adipocyte membrane, and then the fat leaks out from it, and obviously fat cells destroyed. And most importantly, the blood vessels are coagulated around the area where the laser is, again, causing no blood loss or minimal. What's important here on the next slide is what we see is, it's all about contouring. It's one thing to debulk somebody with liposuction. It's another thing to get what we call a smooth and optimal result. So what we like about this particular device and other liposuction devices is the disruption not only causes the removal of the fat, but what you want to have is you want to have a residual nice contour. So you see on the initial slide there, the H&E slide, that the epidermis has a little dip to it. And that's certainly a no-no, and that's not what we want. And we get very upset if we see any of those irregularities. But after the laser lipolysis, it builds the reticular dermis and again supports the epidermal layer and gives you that smoother appearance. So our expectations are usually one, again, patients will come in, they want their abdomen, their inner outer thighs, their bra line, arms, chin, neck, jowls. You can't do all that. We limit it by how much tumescent fluid that we can give them under one setting. The end result, we always tell our patients, is 6 months. Again, they should get a result much quicker, but their final result, again, end result, is about 6 months. Obviously, you can always have side effects, bleeding, infection. Fortunately, I've not really had too many of those at all, and have had to take nobody to the operating room to fix this, and I just feel fortunate about that. So our protocol is they arrive, we have a little lockbox for personal items. They come over to our operating room in our office. We mark the area, take photographs. I can't emphasize to everyone how important photographs are. And when you take photographs, make sure that you take them exactly for your pre-op and your post-op. The worst thing is when you have photographs that don't match. And again, I'm a big believer in having a real photographic system with a dark navy blue background that's recommended by the American College of Plastic Surgery, which I think is very important, so that all skin types can be reflected evenly and there's no real shadowing. We optionally give them a milligram of Ativan if they'd like. Again, just for an educational point, it's the only thing you can use in that setting because Ativan is broken down in the kidney and not the liver and won't interfere with the lidocaine that's trying to be, quote, rid of in your system. So we use a milligram of Ativan if they need it. We obviously try to do it as sterile as possible. We do a little cold spray called Pain Ease and freeze the skin. The reason we use this Pain Ease brand, by the way, is it doesn't cause any hypertrophic areas to the scar or will not cause any bleaching of the skin at all in all skin colors. So if you're using ethyl chloride, I would tell you, be careful of it because it can happen, and Pain Ease doesn't do that. And then we give them a little local anesthesia. We make a little mini incision. We put our tumescent fluid in. We put eyewear on. We use the laser. We then test the fat to make sure we have melted it adequately. We aspirate the fat. We then sit or stand them, which is such a great situation because right then and there, if you have any contour irregularities, we usually will be able to fix it right then. And that's really a tremendous benefit of doing it under local, especially in an office setting. We obviously clean the area. We put a little Band-Aid. I don't close the little mini incisions. They close in 24 hours. But any excess tumescent fluid, we want that to leak out of those sites. We do give them a compression garment, and I give them a homework assignment with a massage ball, and we want them to massage the area. As the area between the skin and muscle where the fat was, you're going to collect some fluid, and that's going to mix with your platelets and give you what we call those pseudoscabs or those hard areas. And I think massaging keeps the patient engaged with you during their recovery time. Post-procedure, we want them to kind of relax the rest of the day. They certainly can take a walk. The compression garment, again, 24/7, except for showering. I do see them back at 2 weeks. I used to see them back much earlier, but they may have some bruises, and it really wasn't a good result of what we really had. So I've gone to the 2-week period of seeing them back. We don't want them to soak in a bathtub, shower with the Band-Aids on. Believe it or not, they can get soap in that area and cause a little problem. No strenuous exercise for 2 weeks or until I see them back, and they can return to light work in 1 or 2 days. They're instructed to massage the area, and sometimes we use, which I got a beautiful unit from BTL, an ultrasonic device for any hard areas to smooth these out, and I really love that device. And at times our staff will help them with any real hard areas. So again, this is from our American Academy of Plastic Surgery. These are areas in which you can perform liposuction and areas that you have to stay away from for various reasons. And it's really important that we adhere to this, as we don't want to disrupt any fascial regions or get into any blood vessels and cause any major effects in a negative way. So now let's talk more about EMSCULP. And again, EMSCULP to me was something that was just amazing. When I first discussed this with the company, I honestly could not believe that this could really be possible. And I was so excited about it and still remain incredibly excited about it, as it's such a great impact in my own practice. So again, the one and only non-invasive procedure to build muscle and burn fat. And we'll get into the specifics of how I think it really impacts what we're doing in liposuction. Again, game-changing for sure. And it really does bring that next level of body contouring to the, to what we can do for our patients. I mean, there's nothing better. So it has 5 approved patents for patented non-invasive technology, again, for fat and muscle, and we'll explain to you why. So how does it really affect the fat and muscle? The high-intensity focused electromagnetic energy selectively interacts with motor neurons, not the sensory neurons, which is very important, while the skin remains unaffected. They cause these, what we call supramaximal contractions, and that causes a rapid metabolic reaction to the fat cells, which then have to feed that energy to the muscle surrounding it. So it's really localized fat disruption. The fat cells are overwhelmed by this metabolic reaction and again initiates what we call apoptosis or cell death, which obviously is our goal for that excess fatty tissue. Again, the resulting effect of muscle strengthening, growth, and fat disruption is really a home run, and I'll tell you how it really impacts us. Again, the high FAM, or what we call the high intensity focused electromagnetic energy, is really thousands of forced contractions per minute. In a treatment plan, which is a 30-minute treatment plan, you're going to get about 20,000 contractions, which obviously no human being could do on their own. Just doing exercise, doesn't matter how kind of shape you're in. And again, these supramaximal contractions can never be achieved again through normal voluntary muscle action. So what do we really see? What happens, first of all, to the muscle? You get a multiplication of the fibers called hyperplasia. Again, these myofibrils are really multiplying. And what else is happening is this volumetric growth or hypertrophy of the muscle. Again, as you'll see in our pictures towards the end of this presentation, these results are just amazing. The fat, again, you get this apoptotic effect. The apoptosis and fat disruption, again, that's great because that feeds the energy to the muscle that's surrounding the area that you're targeting. So when muscles are really exposed to these conditions and this supramaximal contractions, again, you can't do this voluntarily, but what really happens is the muscle has to react, and it reacts basically right after the muscle's contracted in that next 24-hour period. And therefore, what happens is that you get the multiplication, as we said, of the myofibrils and the hypertrophy of the muscle, or that muscle building. Again, that's what we're all here to try to achieve, to give you that better body contouring appearance. So what really happens to the fat? What happens is you get this lipolysis within the cell. The volume of these free fatty acids are triggered and released from the triglycerides. And then these are consumed as an energy source for the body normally. However, these free fatty acids are accumulating in the adipocyte. And again, that causes dysfunction of the fat cell. It's not signaling its normal functions. Therefore, what happens? It basically dies and apoptosis occurs. And it's removed from the body. And what's really nice about it, again, you can localize that kind of fat disruption right at the area that you need to. So what really happens to all that amount of free fatty acids and all these mechanisms going on in your body? So one of our great colleagues, Bob Weiss, did a really nice study, a histologic study, showing that the fat cell death increased in the 30-minute treatment from about 19 to up to about 36, 38%. And this reaction shows that it did not cause any ill effects in your body overall, which is really key. There's no risk to your body from this destruction, even at this rapid pace. And again, Hal, having treated hundreds and hundreds of patients, and all our colleagues have treated them, we've not seen any of these type of metabolic disarrangements or dysfunctions at all. So I was involved with Dr. Bruce Katz. We were doing the ultrasound studies, and we wanted to really show whether or not you really get any subcutaneous fat reduction. So these are a couple pictures and slides of what our ultrasonographer was able to do. And if you can see on the initial picture, the amount of fat that is laid below the abdominal wall, we measured this around the periumbilical region. And then a month later, you can see the reduction. And again, the average reduction, as you see on your slide, is about 19% and 4.4 millimeters of the fat layer reduction. And just in our surveys to our patients, again, over 90% satisfaction, which is pretty darn good. What we really see is, again, this cumulative effect with the 4-treatment protocol, which the company has outlined, again, with our colleagues helping them get all the kind of protocols, and that's what we're seeing. You can see very nicely on the MRI study that was done by Brian Kinney here. You can see, and if you look below, you can see the thickness of the subcutaneous fat, and you can also see the hypertrophy of the muscle. And you can read the numbers as well as I can repeat them to you. Again, it's interesting how correlated, almost identical to what we found in our ultrasound study of about 18.6 or 19% reduction. What else is really amazing and very helpful to me, doing a lot of abdominoplasties, we see that the reduction in diastasis recti, which is really a problem for women, especially, you know, the postpartum women, they get that real widespread of that area in the upper muscular region. And that actually reduced quite a bit, 10% or more actually. And the average increase in muscle mass, about 15%, is just really awesome. And very quickly, which I'll get to. So again, we're going to talk about, is this safe? Of course it's safe. It doesn't carry enough energy ionized molecules or affect any change in the cell structure of the body. What's important, it does not affect the sensory nerves. For many of you that have some of the other devices that are out there, the non-invasive ones, on the cold side or the heating side, you know exactly what I'm talking about. That definitely can cause some sensory nerve deficits and problems. And again, this has not caused this at all. It is non-radiating, so there's no radiation. And again, non-thermal. And I cannot emphasize to you all how important it is, the fact that the sensory nerves are not at all affected in a negative way. So this is really my whole thing of what it does for me as far as post-laser lipolysis. And I'll just read it to you. It's effective for my patients who have had small amount of residual fatty tissue or contour irregularities. And I'll get into that in a minute, how I specifically use it for that. In addition, the muscle tightening, growth, and the hypertrophy and hyperplasia of the muscle, again, is a new paradigm shift. There's no other device. There's nothing else that's been out there. Nothing else out there that can really give us that high definition body contouring. which is the desired result. For many of you that do a lot of liposuction, we used to do an awful lot of what we call the high definition liposuction, where you would carve the tissue and the soft tissue. And if you look at some of the long-term results, and I've seen them in my own practice, having done a lot of high def, you do see that over time, that skin and that high def really kind of blends in and they lose it. Where if you're actually able to hypertrophy that muscle, it stays. And that really is what's nice about this treatment and this device. So how do I really use it and what I personally do? Let's talk about it. So for post-laser lipolysis use of EMSCULP, they desire to have a full effect on body contouring, which only EMSCULP provides muscle building. For years, what I used to do, and it's really amazing how things have changed, I used to give my patients actually a membership for 60 to 90 days to one of our local health clubs and try to get them to exercise. You know, it's like anything else. Right after New Year's, everybody goes and signs up, but do they really ever really take care of it and go? No. I'm not saying it's a complete substitute for going to the gym, but if you do that along with doing the EMSCULP, you really have something. And you know, it's like anything else. If you get that real initial stimulus where you really see something, then it'll drive you to get there. So we really feel like this is the impetus to really get to really having that solid body habitus. So if we have a little residual fatty pockets, and I've had that, hopefully not too often, but what we try to do is we've tried to treat it with external devices to remove fat. I've injected products such as Kybella, which we know can, quote, dissolve fat. It's painful. You know how much swelling you get if you've ever done this to the neck region. You have to do it multiple times, and the results to me have not been consistent. Have I had to return them to the OR for a touch-up? At times I have. I obviously don't like to have to do that, but if you do, you do. And freezing or heating the area, I have tried this extensively, and I think it's very difficult to target those specific fatty areas. However, with EMSCULP, I can target those residual areas of fat and create muscle hypertrophy within the, and my eventual result is that nice skin tightening and nice body habitus. So I've been able to target it with our paddles and use, and we've really, our staff has been phenomenal at being able to really place the paddle exactly where we need it for those particular needs. So let's talk a little bit about the buttock. It's really the first non-surgical approach to improve what the buttock looks like. I do a lot of fat transfer, and I'll tell you more about that. But it's really ideal for patients unwilling to opt for an injectable, such as sculpture or a surgical procedure. It strengthens, lifts, tones, and gives that beautiful round feminine buttock. And I think it's incredibly, just an amazing thing to add to your practice. I really like the fact that most of the patients that we have done as a standalone love it, and then I'll tell you a little more in the next slide or two about how we do it with fat transfer. So for my fat transfer patients, the fat should be placed, number one, in the subcutaneous region. I've had this discussion with many of my colleagues and probably some of you that are on this webinar with me. If you choose to do an intramuscular fat injection, they've caused major complications. Even death is noted in the recent literature. And if you've not seen it, I'll be more than happy to send that to you. So we really do stay in the subcutaneous region only. Anyone performing fat transfer of the buttock would really benefit adding EMSCULP treatments to their patient in order to complete the body and buttock contouring. When I sign our patients up, and we do with our patient care coordinator, and we talk to our patients, we tell them that if you really want a complete buttock contouring, we have to add the EMSCULP to it, and we definitely do that. So many of you may have started using sculpture for injectable into the buttock area. You know how expensive it is. It can require multiple treatments. I have one colleague who unfortunately had a major complication injecting it, where they got some electrolyte imbalance and had to go to the hospital. I fortunately have not had that happen, and the results are not immediate and questionable long-term results, and it takes a ton of vials to really get any kind of effect. So my personal protocol is to perform my fat transfer, then EMSCULP to the buttock by about 3 months in order to achieve the optimal result. The number as far as 3 months, 4 months, or even a little bit quicker really depends on how well they're healing. So we examine them and we want to give them the optimal time. We certainly want the fat to take. By the way, the device itself has 2 protocols, and the second protocol, you're able to just cause hypertrophy and hyperplasia of the muscle and not destroy the fat. And I'm sure many of you may have that question. If it's destroying fat, why would you put fat in and then obviously do EMSCULP to the buttock? So we would use protocol number 2 for that. So how's it really an additive to your practice? You know, you're going to have clients come in and they don't want any invasive technology at all. And you can get a really, really nice result, which I'm going to show you in a few minutes. We offer EMSCULP as a follow-up to laser lipolysis to increase the muscle mass and enhance body contouring. It's brought to our practice an incredible revenue, and I'm very honest with everybody to tell you that, as both a standalone procedure, which we have a lot of patients, again, don't want anything invasive at all, or we add it to our laser lipolysis, and certainly our buttock augmentation with or without fat transfer. So we feel it just added a whole new armamentarium of things we can offer our patients, and even the things that we thought we were getting great results with, we're even getting greater results with. We strive to market these services as a dual enhancement package. It's really always discussed with them in our initial consultation, and we do show them some of our pictures. Obviously, we show them some of our better ones. We also show them some ones that we're not as happy with. So we, you know the old expression, we want to under-promise and over-deliver. We do offer a package when EMSCULP is added to the post-laser lipolysis and the fat transfer. And we market EMSCULP again as a standalone, if that's what they desire, or an add-on after the laser lipolysis and fat transfer treatment. The cost is $3,000 for 4 treatments. Again, if they're doing a lot of different procedures, we'll put that in as our package for them. But we always want to charge the $3,000 for the 4 treatments, which we think is a very reasonable cost for these great results. So I'm going to show you a few patients. This is a patient baseline came to me. She did not want to have a large buttock. She really just wanted some buttock contouring. We added just a little bit of fat, and the EMSCULP is there post-procedure. For many of you, if you can see, do you see our gluteal crease there, how nicely defined it is, and how rounded the buttock shape is? And we think that's a really nice result. One of my earliest ones I did. Our second one is very similar with the contouring with fat and EMSCULP. Again, if you look in the upper right of the right cheek up there, there's probably a little bit of fat that's still in there that hasn't completely dissolved in the area I'd like it to be, but you can see how much more contoured her buttock is. And again, she's very, very happy. This is a really interesting patient. We did some buttock contouring, especially below the gluteal crease there. As you can see, we nicely shaped that. We put just a small amount of fat in there, and then we used our EMSCULP, and you can clearly see how nice those dimples are really smoothed out. And again, she's very happy with her result. And again, these are just in progress. We will not see our full results for the next 3 months or so. These are all 6 weeks after our 4 treatments. This is a very interesting guy. It's an old liposuction patient I had. And as you look at him before there, he has a large amount of visceral fat and has some subcutaneous fat. And 8 years after his liposuction, he comes back and I said, boy, you have an awful lot of visceral fat. And he says, well, what about this new device that I heard about? We had a nice long conversation about it. And I have to be honest with everybody here and tell you that I really think we need to study what it's really doing to the visceral fat. Because I don't know if you guys can tell, but you're talking about a short amount of period of time. You're talking 4 treatments of 2 weeks and 4 weeks. You're talking about 6 weeks. And you can see what a dramatic result he had, not only on the visceral fat, on subcutaneous fat, but the visceral fat as well. So we're really excited about that being another added advantage for us. This is our classic pre-lipolysis, post-lipo, and then you see the EMSCULP. So I think she got a really nice result from our liposuction, but got a phenomenal result after the EMSCULP. Again, 6 weeks after our 4th treatment. This is also a pre-lipolysis post-lipo patient, again, a little larger. And you can see the post-EMSCULP picture, which I think speaks for itself. Again, she was quite happy. And again, we're anxious to follow her up and seeing how much she's going to improve over the next few months. This is a patient, what we call patient baseline. They presented, this is just classic EMSCULP after. This is not performing any liposuction. This is just this patient presented, and here she is post-EMSCULP. I think it's pretty dramatic. I'd venture to say that these results will compete with any of the other non-invasive devices, and I mean, that's just such a beautiful result. And last but not least is my one of my favorite patients, and actually we've become really close friends. But here's a guy who comes in presenting, works out like a fiend, and here he is after his post EMSCULP treatment, and you know, he has just the most phenomenal physique right now, and he's absolutely thrilled and can't say enough about it. In fact, wants to do any videos for us in our office. He's just beyond thrilled. And here's a guy who really watches his diet and exercise. And I have to tell you, if you're thinking about it and you perform any liposuction, not having this other device to add to what you're already doing is really a miss. And I just thank you all for your attention. I hope I didn't go over too much, and we're going to take some questions.
Thank you, Dr. Goldfarb, for enlightening us. At this time, I'd like to encourage the audience to please type in any questions that you may have into the chat bar. And as we're waiting for questions to come in, I actually have a couple of questions of my own, Dr. Goldfarb. The first would be, you spoke a lot about treating small pockets of fat post-lipo, but please discuss how big muscle hypertrophy and hyperplasia is to your clients.
Yeah, I think that's what they come in for. They, you know, they say, I'm working out, I'm not seeing anything. In fact, some of them has said they force their workouts, and when they get some hypertrophy, the fat pops out more. And what we do is when we remove the fat, and then they're saying they're not, you know, they're going to the gym, they're working out, they're not seeing the results that they expected to see. And then we turn them on to EMSCULP, and you get results like this gentleman. It's just really amazing what it's done as far as shifting in the body contouring field.
Okay. And for people like this gentleman, are you actually recommending maintenance procedures to him? And if so, how soon do you actually recommend maintenance for him?
So he would come back at 6 weeks. We follow him, and then at 3 months, and then at 6 months. So he happens to be somebody who works out all the time. I don't schedule a absolute regimen of follow-ups with EMSCULP. I know some of my colleagues have already said that they put him into a program where they will do monthly treatments. I really do follow them. My own feeling is that you know, you're really paid for a treatment, and that should really give you a result. I do tell them if they're not going to work out or follow up with it, then they will need a series of repeat treatments at either 3 months or at 6 months. So what I do is I follow them with serial pictures, and they're part of my practice, and that's how I particularly follow them. I have thought about putting him into a maintenance program. We've discussed it, and I'm not sure I really want to go in that situation yet, but I do think it definitely helps to do another series at 6 months or later would probably help. But again, I don't know that everybody has to do that.
Okay. Another question for you is, a lot of people are actually wondering about, do you have some special kind of technique where the placement should go of the applicators for both the abdomen as well as the buttocks?
Well, we do. And I think there's an awful lot. I know everybody wants to be able to say you put the paddles on, you walk in the room when we start the procedure, and you walk out in 30 minutes, and that's fine. My staff is so enamored with this device that they're constantly in the room with the patients. They certainly get the level of intensity up as quick as they can that the patient can tolerate. And they constantly will adjust the paddles. Sometimes the patient moves. They're sitting there, they're watching TV. and they'll move around a little bit in the paddle despite us putting it on. And it's a really nice way that with a Velcro strap, it does move a bit. And we feel that by adjusting some of the paddles, and we're getting even better results. And I think some of my colleagues I know have said something to me like, why are you getting even better results than I am? And I think that has a lot to do with what our staff does to help these patients get that. So I do think it's very beneficial to have somebody monitor the patient at least every few minutes, change the angle, the paddle, and I'm seeing a definite increase in body contouring result.
Okay. Next question is from Noreen. Have you ever treated a patient beyond the recommended BMI for EMSCULP and still receive results?
I actually have, and I can probably furnish that picture to her if she wants to send it to me. She did get a really nice reduction. I was kind of amazed. We did it more of a trial. She, again, didn't want anything invasive and honestly had other treatments that were in the, quote, non-invasive field that I won't mention, but you can imagine. And she actually feels she got a result from what we did. Her body habitus was very similar to one of the other pictures there before we treated that one with liposuction. So I'd be more than happy to send that out to the group they can see what kind of result we got.
Okay. Next question is for our very athletic patient. Did you use 2 applicators at the same time? And if not, when do you actually use 2 applicators?
We always try to get the 2 applicators on the abdominal region, especially in an athletic patient. If you can't, what we do is we'll turn it in certain positions at various intervals during the treatment. But we really do try to get both paddles on, because I don't know if you can really appreciate, but you can see, like on this gentleman, if you still have his picture up there, who's very athletic, we really got nice results on his flanks as well. And we did not have the paddles on his flanks, but he really got, and he can feel the contractions right over the oblique region, the oblique muscle area. So I think it is important to try to get the 2 paddles on them.
Excellent. And I have 2 more questions for you, but before I start with the next question, I just want to encourage the audience, if they have any further questions, please continue to type them into the chat bar. The next question comes from Cynthia. She says, have you ever used the EMSCULP on the thighs or arms? And if so, can you discuss?
Well, we actually have done that in our initial trials at this point. And perhaps, John, you can discuss the next aspect of that from the company standpoint and explaining where we're going with that.
I guess from the company's perspective, we hope to have an announcement for you in the end of March about some further developments for arms or thighs. The thighs are currently on label, and the arms, there may be some news coming out about the arms very shortly. Next question that we have is, your 3-month post-fat transfer, have you ever thought about 3 months before? So the muscle is growing when you're doing the transfer. How about pre-lipo? Pre-lipo surgery is scheduled out some 4 to 6 months.
You know, I have tried that on a few of my good patients that I know. I haven't seen a result making that much of a difference in that regard. And to be very honest with you, a lot of the patients, you know, they take off time to get their liposuction or take off time. I don't know that they'll take off time for that as a pre-setting. I think that's something that I would like to do as a study and really see if it makes a difference. I have not had enough experience doing it pre-liposuction to tell you that. I know my staff would love to do that pre-lipo. In fact, we had that discussion last week about doing that on several of our patients that have signed up for liposuction. So I can't give you a complete answer on that personally, but I do think it's worthwhile studying, and I think it may improve our results.
Okay. Next question is, can you treat lower abdomen for 30 minutes and then treat the upper abdomen for an additional 30 minutes in the same setting or same sitting? So
no,
total.
The actual 2 paddles will cover the upper and lower abdomen adequately. And unless it's a very, very large, obese, probably a BMI, a large BMI over 30 something, the answer is that you can treat them in one setting and cover the entire abdominal region.
So for a female, would you then turn the paddles horizontal or the
I
applicators
would,
horizontal rather than vertical?
I would. In fact, our patient care coordinator who's taken this on tremendously is really doing her own little study showing me how she's turning the paddles, taking pictures, and what kind of results she's getting. So we are seeing that if you do manipulate them a bit, you can really target some areas that are tougher and not as responding as well and making it more uniform. So I think there is some learning yet to be done in this field to get the optimal result.
Okay. Speaking of optimal results, our next question comes from Sasha, and she wants to know when you actually see maximum results with EMSCULP. Is it after 4 treatments? And what's the best time for the post pictures?
I think that's a great question. What we have been doing is following kind of our FDA protocol studies. We did our 4 treatments, 2 a week for 2 consecutive weeks, and then did some follow-up at 4 weeks and at 6 weeks, and then again at 3 months, and then at 6 months, and then out now at a year for our initial patients. And we have seen a progressive improvement again in the majority of patients. I'm not going to tell you everyone. There are some, it's like anything else. There's some that I think get stagnated in certain areas and they don't seem to improve as much. But for the most part, I'm seeing them at 6 weeks after with remarkable results, and then at 3 months and 6 months, still improving.
That's excellent. At this time, I don't see any further questions. Actually, no, another one just popped in, Dr. Goldfarb. It says, can the patient use their cell phone away from the applicators? And should we tell them to take off their Apple Watches as well?
Yes, we do. We make sure they don't have any of those kind of devices near the device. It's an MRI type of device, and we don't want them near. We don't want the cell phones near, and we certainly have a little table that's far enough away that it's not on their body or close to them. So we don't want them to use it during that period of time.
Okay. Next question comes from Carol. She says, can you use the EMSCULP in combination with Vanquish Me? I'll answer it first, then you can answer as well, Dr. Goldfarb. But there are a number of physicians that are actually using Vanquish Me in combination with EMSCULP. They debulk the patient first, then they go back after the patient um, after the patient's lost that fat to really help the muscles come through. They then treat with EMSCULP. Um, Dr. Yale Halas, Dr. David Kent, they've done a number of different patients. It's been published in Modern Aesthetics as well. And Dr. Goldfarb, do you have any thoughts on that?
Yeah, I think that combination is great. I really do. And even after some of the other devices, I've also used it. But I do think the Vanquish actually seems to give you a little bit better result, even than some of the other devices that I've seen and utilized. So I think that combination is a winning combination.
Okay. Another question. If patients are still seeing results from the initial 4 treatment series, at 6 months post, should we not be recommending maintenance treatments until after the 6 month mark?
Yes, I really believe that. I am a firm believer if a patient, pays for the procedure and still getting a good result, I don't just say, okay, well, now it's just time you have to have another treatment. It's just my own philosophy. I'm one to believe that, patients paid for what they got, and I'm happy to provide a service when they need it. And I do that with my hair patients. I do it with all my patients where I really like to follow them. It adds a lot of time to my schedule, but I really do think that's the ethical way to do it. So I don't think there's an absolute guarantee way to do it that way. And, but, we've retreated some of our patients at the 6 month period of time. And again, I think their improvement was dramatic, even at that time.
Okay. And I know Bruce Katz's office was on a moment ago. I don't see Bruce on at this second in time, but I know that he's been instrumental in a number of studies as well. And um, what he's been able to do, sorry, there was another piece that was beeping in, but what he's actually been able to do is actually show that muscle continue to increase up into about 6 months, and then it will start to wane off. So there'll be some studies that'll be coming out in the near future that will discuss that as well. The
Yeah,
next, or go ahead, Dr. Goldfarb.
Bruce and I did that ultrasound study together, and I thought that, but some of our ultrasound patients, even at the 6 month and above, were still getting some nice results. Again, a lot of the patients that we studied, I think, were more athletic and continued to work out. So perhaps, it all has to do with their lifestyle and what they do, how they eat. I think there's a lot of factors, but I do agree with that with Bruce. That makes a lot of sense to me.
Okay. Another question, and I'll just let you answer this one, but it says, do you think using EMSCULP before liposuction would alter the fat if using the fat for grafting to the face?
I think if you use the number one protocol that causes the apoptosis of the fat, yeah, I think it could alter it. If you use protocol 2, which really doesn't affect the fat surrounding the muscle, then I don't think it will destroy any of the fat itself. You certainly don't want to disrupt the fat that you're going to place for a fat transfer. So that would be something that I would be very careful to do, and I would definitely use the protocol 2 for that.
Okay. And at this time, I'll give it a couple more seconds if any more questions come in. But at this point in time, there's no additional questions. So let's give it one more minute, Dr. Goldfarb, see if the audience has any further questions for you. Okay, actually, another question for you. How soon after abdominal liposuction would you start them on EMSCULP?
So what I do is, again, I see them at my 2-week period. I see them at 6 weeks, and then we see them at 3 months and 6 months. I want to make sure that the post liposuction result is solid in there. They don't have any more residual, what we call grunge and all that type of material in there. So if they're healed from that, even at 6 weeks, we would start them at that period of time. Again, some people heal a little bit slower, and we gauge it at that particular time. But I have to do what's called the clearance to get them into that next stage for EMSCULP. So I would say generally about 6 weeks.
Perfect. And then Sasha wants to know how you actually market EMSCULP right now. What are some of the tactics that you use?
Well, we think we have an excellent marketing company we particularly work with, that I've worked with since the inception of my own practice. They do an incredible job, and we are able to reach our patient base, I think, which is really important. When we first got the device, we sent out an email and invited them over and had a kind of an event at our office. But I think it's very interesting that you really will kind of market to your own database, and then you can do some outward type of material as far as the internet and everything. And I will say that the company has really been tremendously supportive, not just because John's on the phone, but they have been great and supportive. And the word is getting out. They're getting a lot of PR in the major media outlets. And I think more and more people are knowing about EMSCULP. So I think it's just a growing business. But if you had any particular specific questions on marketing at all, again, please contact me, and I'll be more than happy to go over what has worked for us.
Okay. Again, we're out of questions. So if anyone has any additional questions, please feel free to type them in the chat bar right now. We'll give another couple seconds, Dr. Goldfarb. I do know we're run up upon the limit. So actually, here's the next question. What is your contact email?
It's very difficult. It's my name, Richard Goldfarb, MD, @gmail.com.
Okay. And with that, I think it's probably the perfect time to end this evening's webinar. So I know for Dr. Goldfarb, you and a number of people there on the East Coast, it's very late. So we thank you for taking the time to join us, taking time away from your family. We hope as BTL, we can serve you in the very near future. If you have any questions for Dr. Goldfarb or for BTL, feel free to reach out to either party. Thank you.
Thank you all for your kind attention.